This one's going to be a fast one, because you guys are going to be awesome at this, okay? Dispatched for a...
Transport.
Diesel.
That was fast.
Fast.
Uh-oh.
Oh, no.
Off the list.
It's all right, I just got my little memory here. So, dispatch to shortness of breath and chest pain. Okay? 70-year-old male. No, let's go 40-year-old male. Sorry. 40-year-old male. Okay. Man, I'm trying to do it without giving it totally away. Alright, you guys are going to have to ask some history stuff. Yeah, 40-year-old male at home. And I got chest pain, shortness of breath. Go. Speed.
Can you describe the chest?
Pale, cool, diaphoretic. I don't feel good. I'm going to pass out every time I stand up. Things are not good right now. I'm
Okay.
going to throw up too, by the way.
Okay.
I may have some uncontrolled diarrhea.
Can you describe the pain for me?
It hurts
So
really bad.
vitals.
Okay. Can we put them on a floor?
Yeah, you sure can.
Can we do that and give vitals?
Oh, you want some vitals too? Okay, so 100 over 50, pulse of 110, and Sats 98, pulse respiration 16. This is your EKG right here.
Okay.
Sorry?
Circle bump?
Semi.
So we've got a STEMI.
Oh, stand by, actually. Keep asking questions. I'll give you your full 12 lead. I got everything for you.
Does the pain move anywhere on your body?
It just hurts.
Are you currently on any medications?
You don't have the
Yeah, I'm
balloon.
on.
Ah!
Oh, jeez. Xarelta. I'm on Xarelta.
You're the
Oh,
one
zero.
you're the one who's talking.
Yeah.
Oh no, I thought you took it.
No, let's go.
Allergies.
Allergies, yes.
Has this happened before?
No.
Oh, what are you allergic to?
Sulfa and penicillin.
That's common.
Curiosity. It's just
All right, raise your hand if you got a question.
When did this start?
It started an hour ago.
this come on all of a sudden or gradual?
I would say for the most part, it's kind of a sudden thing. It was a little bit, but it just kept getting worse and worse and worse all over
How
like
long ago
10
did it
minutes.
start?
10, 15 minutes.
That's your
Anything you do make it better or worse?
No, not really.
No. Does it?
1 and 2.
It's in more than just that.
Are you allergic to aspirin?
No.
Do you have any, have you had any blood in your stool?
Blood in the stool, no.
Okay,
Can we give you aspirin?
piggyback off that.
Sure.
What were you doing when it started?
No, I was out working, cutting down some trees, and I was limbing my tree.
You would help you
Yeah, I would think that I'm healthy.
What's your confusion of healthy?
When it started on someone's.
Follow up on your question.
Did anything happen when you were out living your tree?
Like, what do you mean anything?
You get stunned by
I
something.
might have fallen.
What'd you fall
How
on?
far? About 10 feet.
Can I listen to your heart?
You fell 10 feet?
Really?
Dude, yes! Did you hit
Can you work on describing that plane for you? Is it sharp? Is it dull? Is it radiating
Dull.
anywhere?
Did you lose consciousness before you fell, or you did feeling dizzy at all?
Nope.
Does anyone check lung sounds?
Lung sounds? Clear, equal, bilateral.
And this is, we got her
Like,
ECG.
any external injuries?
External injuries, no.
No broken wrist?
So we got our vitals. Can I get, while I continue asking questions, can I get IV set up? IV access?
Somebody already took care of that.
Great. So can you tell me more about that fall?
Yeah, I just fell off the
What were you
ladder.
doing before you fell?
I was in the tree, cutting
You
my
were in the
limbs.
tree. Did you feel dizzy before you fell?
Nope.
No.
Why do we have partners if we're not going to listen to our partners?
Too many partners.
Too many partners.
Pain before, did you start having the pain before the fall or after the fall?
After the fall. About 10 minutes after the fall, I started to have the pain.
How are your eyes?
Earl.
Did we ask
Can I?
anything?
I'm not on my computer.
Okay.
Can I look for jugular vein?
You can look for for it.
Tell them to check.
You have it?
It won't be present.
I do have it.
Yes, you do have it.
Oh,
Oh, transport.
Okay. Sarah, what did you ask? What did it feel like?
Oh, like here, I'm rated 110, huh?
So he's gonna have.
Next triad.
Lead to
Not,
a.
not correct.
Is your blood pressure changing 10
So you guys went ahead and gave the aspirin for this. You got an ST elevation MI, right? You guys gave aspirin.
Depression. Who gave the aspirin?
Mars. Well, it's already on, so here we are.
Should we transport or go through?
We give them a say, yeah? Put her name on there.
What'd you hit when you fell?
Wait, who gave aspirin?
They have.
Andrew.
I'll take that. There's nothing else we can do.
Okay, JVD.
I wouldn't.
They have,
Yeah.
He's taking
they have the next triad, right?
What, I don't know, I don't even know what Beck's triad is.
Yeah.
Jugular vein distension.
Do you have the balloon?
You asked a question.
Right, but I was waiting for hands, and then I'm just like, oh, would you like the talking balloon? Do
There's blood
you want it? Do you want it? Okay, cool, good.
I kind of want to know what it is.
I think Annalise is back.
Do you have it?
Take it.
Get it, girl.
So they have low blood pressure, they have JVDs, and do they have muffled heart tones?
I don't know, somebody tried listening, didn't they?
Yeah.
Huh,
What'd you say?
weird, they got the balloon immediately taken away from them, huh?
Because you can't really.
The answer is yes.
Yes, they do.
It is
The
a
transport code 3, I'm concerned they have a cardiac tones. And we made it worse because we gave aspirin,
Yo! Hey, so like I said, we get the whole picture before we start our treatment, right?
Great.
Just because can a cardiac tamponade present with ST elevation?
Yeah.
Yes.
Why?
Oh, do we
It's
have
blocking
lower
blood flow.
voltage in our QRS complex?
Holy moly, no, you got that right there.
Why don't I read that yet? That's
I don't
like
know.
5
I
minutes.
don't know. I don't know.
So absolutely, so what is the cardiac tamponade?
It's with
The pericardic.
There's fluid in the
pericardium.
side.
And it's push the heart.
And it's
And it
squeezing the heart.
impedes cardiac function.
Okay, so let's back up a second. Does everybody agree, based on physical findings and history and everything, that this person has a cardiac tamponade?
Yeah.
Yes.
Is there anybody in here that disagrees with that?
Why
Anybody?
is their blood pressure so high then?
The 100 over 50?
Blood pressure. Their blood pressure was 100 over 50.
100 over 50 was this one, was that one. It's on the low, it's on the lower end of normal. I didn't bottom it out because if I gave you the textbook Beck's triad, then you guys all jump right on it because you guys just went over cardiac tamponade. I know what it is before I even asked any questions whatsoever. You'll be like, oh, okay, cool, that was really fun. You guys don't have to think it all, right? So you're not always gonna have the entire textbook Beck's triad, just like Cushing's triad, right? The high blood pressure, Chang-Stokes, you're not always gonna have all of them. So you gotta work through it and you can be like, hey, I'm gonna listen through this thought process.
I have a question.
Yeah.
Oh,
There you go.
So like the history of falling off the ladder points to that trauma, but didn't you have JVD for other reasons like CHF?
Absolutely.
Or attention pneumothorax.
Absolutely.
But the
So
lungs were fine.
the lungs are fine. So what additional information was asked? What additional thing was asked?
JVD.
The muffled or distant heart sounds.
Right. So the one that I didn't let you ask initially because it would have given the whole thing away.
Right.
But I took it away, and then nobody else caught on to
I
that.
thought you took it away because you thought it was a dumb question.
No,
Yeah,
no,
same
no.
here.
Like I tried to keep.
There's no dumb
I tried to keep
questions.
you guys from getting the answer within the first 2 seconds because when you get that within the first 2 seconds, which is what I want you to do, but you guys immediately eliminate your history taking. You'd be like, oh, I know exactly what it is. This is what it is because it meets the textbook thing.
Because we're done.
Yep, and we're done. We'll move on.
You said you wanted it fast.
Right, no, I did, but I wanted you guys to hit specific benchmarks in my mind that's gonna lead you to this point, okay? So we had our Beck's triad, so so nobody really asked like, hey, did you get hit in the chest, did anything like that? So yeah, I took a fall, landed right on my chest. I said it started happening about 10 minutes after the fact. So all those things kind of building the case in your head, you're just like, oh, this is really starting to make up. So you can end up with fluid around. How do we deal with that?
We can't.
Paracentesis on
That's
the
what the
scene.
doctor does. 45-degree angle, right? Boom. 45-degree angle. Is that
We're
how
not
you
allowed
process?
to do that?
Just like that. You
Yeah,
stick the
with
needle in
the
there. So-
electrode on it, so we know it's like a heart.
So this is legitimate, non-national stuff anymore. It used to be in the paramedic curriculum. So you come in with a needle, 45-degree angle, have them on a heart monitor. You advance the needle, slowly aspirating the needle, kind of like how we do when we're cranking somebody. You advance a 45-degree angle from the xiphoid process, and then you watch. You watch for PVCs, PACs, an irritation of the heart. Once you hit those, then you're like, oh, I should be right about there, and you're pulling that counter pressure, and have we ever done it? Like, it was like here, like right when I started as a paramedic, and then they took it away immediately, so no, I've never done it. But, yeah, they say it's pretty easy. You just use the EKG and it's 45, and you just don't
Don't go.
boom. It's nice, easy, pulling counter pressure. So this is what happens. So as the tamponade, as it increases in the fluid, you continue to squeeze down on the ventricles, decreasing your preload, everything backs up. That's where you get your JVD, right? So you're not getting a good flow. That's where you can present with your ST elevation, because now you're not actually getting good oxygen exchange, because everything's clamping down, pushing down on the outside of the heart, on the vessels and stuff.
So do the pulses stay normal, or start normal and then get weaker?
So are you referring to pulseless paradoxus?
No. But that is a sign.
That is a sign, correct. So how are you guys gonna be able to differentiate? So what would you expect to happen with, there we go, so say you got your heart in there, right? So pulseless paradoxus, what is the definition of pulseless paradoxus?
The pulse rate changes.
Pulse rate or
Narrowing pulse pressure.
pressure
So the systolic and diastolic will get closer together.
during what? Inhalation and exhalation, right? So think about it. Remember we talked about the diaphragm. Just to finish this up real quick, got like 1 minute. Think about the diaphragm. What happens in the chest wall cavity when you take a deep breath?
You have less space in there. It's gonna
Okay?
push.
So it opens up the cavity, right? Decreases your pressure, right? So it decreases the pressure inside here on the heart. So the diaphragm now contracts, pushing up on the heart, which now this is taking up more room in there, so now it starts to press on the heart. All the lungs and tissue and everything starts to press, which is going to increase your pressure, right? So it has to increase the pressure in order to get the fluid out. Okay? So are we really going to be able to figure out and take a blood pressure on somebody and be like, hold on, take a deep breath in and out, right? It's really going to be something that's going to be very, very hard and complicated, and you would have to really be aware and be totally, I mean, it's very minimal changes. So I would guess this would probably not be a real helpful tool in determining cardiac paradigm.
If the heart is being surrounded by fluid, wouldn't the pulses, like not the blood pressure, but the pulse itself, be getting weaker because there's not enough room for it to contract?
Like this picture here.
Yes.
So yeah, I mean, eventually, because that's eventually what could potentially happen to the entire ventricle, right? The entire thing, like the muscle tone, the fluid pressure will overload the muscle tone and completely collapse it, right?
So it starts bounding or regular, and then gets
In a fast-moving cardiac tamponade, I would say yes.
Is there anything besides trauma that could cause
Infection,
infection?
yep. So there's infections, I think there's a whole long list. Somebody do their cardiac tamponade thing.
Yeah.
I mean, there's a multitude of medication interactions.
Right after heart surgery.
Right after heart surgery. So yeah, trauma is not the only thing. Trauma is the most common one that we're gonna see. Because all the other ones are really, we're on a wild goose chase the rest of the time.
How much different does muffled heart
But that would be the only.
sound on a bariatric patient versus, like,
It's gonna sound.
yeah.
So if you'll notice in the pre-hospital setting, you watch people get on the side of the heart. Because it's so hard to know whether or not that's muffled for them or not.
But it could be plasma.
Now, if you do a patient, you went on them every day, and you listen to narco, then you would know this is what
Yeah, that's right.
So you look more for your JVD to show you that it's backing
Yes,
up,
and then you're like, yeah,
Yeah.
that sounds like that could be.
right?
Plus the history.
And the clear lung
More
sounds.
to understand the conditions, so that you can rule out things like that.
Yeah, I would give them.
Anyways, you're be scout, you gotta own it.